Grade 10 English. A letter from a patient. Exercise solution. A. Match the words with their meanings. A. Nightmare. 3. A very unpleasant or frightening experience. B. Pediatric. 4. Relating to the medical care of children. C. Intravenous. 5. Into or connected to a vein. D. Priority. 2. A thing that is regarded as more important. E. Medications. 1. Treatment. F. Confidant. Someone to whom secrets or private matters are confided, often a close friend or advisor. G. Deprivation. 8. The lack of something considered to be a necessity. H. Vulnerable. 6. In need of special care, support or protection. I. Dreadful. 7. Very bad or unpleasant. B. Write true for true and false for false statements. A. The sender of the letter was happy with the service of the health workers. False. B. The staff of different departments in the hospital had harmonious relationships with each other. False. C. The hospital staff were concerned with the requirements of the sick child. False. D. The staff of the hospital shared their personal feelings with the writer. False. E. The chart was unclear about the patient's gender. True. F. The author took the mistakes of the health workers normally. False. G. The writer seems to be more sincere in her duty than the hospital staff. True. C. Answer the following questions. A. What was the nightmare for the author? The nightmare for the author was experiencing their 9-week-old baby developing an extremely high fever and being admitted to the hospital. B. What do you think the main purpose of this letter is? The main purpose of this letter is to address the author's unsatisfactory experience during the hospital stay and to bring attention to the need for better communication and patient-centered care among healthcare workers. C. According to the author, what was the main weakness of the hospital staff? According to the author, the main weakness of the hospital staff was their lack of empathy towards patients and their families. D. Did the nurses really say, "Your daughter is not a priority"? Why did the author think so? No, the nurses did not explicitly say, "Your daughter is not a priority." The author interpreted their frequent statement of, "I am so busy today," as an implication that their daughter's care might not be receiving the attention it deserved, leading to the feeling that she was not a priority. E. What do patients and their families expect from the health workers? Patients and their families expect health workers to prioritize their care, listen to their concerns, and communicate in a respectful and compassionate manner. F. List the questions that the author was asked frequently in the hospital. The questions that the author was frequently asked in the hospital were, was she premature, and was your delivery normal? Why did the health workers make gender errors about the author's daughter? The health workers made a gender error about the author's daughter because her daughter spent her time in the hospital wearing only a diaper. H. According to the author, how do people perceive the career of health workers? According to the author, people generally perceive the career of health workers as not being glamorous, but they trust healthcare workers to take care of the loved ones in vulnerable states. D. If you become a health worker in the future, what would be your priority? How would you treat your patients and their families? Discuss with your friends. If I become a health worker in the future, my first priority will be to care for my patients. I will try my best to keep them safe and help them get better. I will listen to the problems with patience. I will give them the right treatment at the right time. I will always follow safety rules and stay honest in my work. I will treat my patients and their families with kindness. I will speak to them politely and clearly. I will explain the illness and treatment in simple words. I will make sure they feel calm and hopeful. I will treat every person with respect and care.